Dallas State Representative Rafael Anchia has filed legislation to improve hospital security and punish parole violators who cut off their ankle monitors.
So the bills would be named after Jacqueline Pakua and Annette Flowers. Both healthcare workers were killed at Methodist Hospital in Dallas last year when a violent felon out on parole shot them. The murder suspect was allowed to visit the hospital for the birth of his child. Fox 4's Sean Rabb joining us now live with more. Sean.
And Heather, you know what, Anchia admits this is not the end-all be-all, but he says something has to be done right now because too many people are just cutting off their ankle monitors. And if this bill becomes law, it will apply to everyone, adults and juveniles.
Just throw the gun outside. Throw the gun out, please.
October 22nd, Nestor Hernandez brings terror to Methodist Hospital's labor and delivery and kills 2 healthcare workers before surrendering.
And so we stand here not out of pleasure, but with a sense of deep regret and mourning.
Social worker Jacqueline Pakua and nurse Annette Flowers were murdered. 2 bills filed by State Rep Rafael Anchia that seek to protect healthcare facilities will carry the women's names. The first, House Bill 3547.
Anybody who cuts off an ankle monitor, regardless of which type, is going to serve not only the rest of their sentence, but also is going to be charged with a state jail felony.
Hernandez was authorized by the state parole board to be at Methodist for the birth of his child. That, despite him being arrested months earlier for cutting off his ankle monitor. Dallas Police Chief Eddie Garcia, a critic of violent offenders out on monitor devices, calls this bill a step in the right direction.
It certainly does soothe some of my frustrations with regards to chance after chance after chance. And I think that's what we're getting at. I think we're getting to a point now we're coming to a time, and this is Exhibit A, of realizing and recognizing that we're giving too many chances to violent criminals and not giving enough chances to our victims in communities and neighborhoods.
Hospitals have to be notified by the Board of Pardons and Paroles when someone out on a monitor is going to visit a loved one. Councilman Tanel Atkins likens cutting off an ankle monitor to breaking out of jail.
You have an ankle monitor around you, you cut it. It's just like you're in jail. It's a felony. Very simple.
The second piece of legislation, House Bill 3548, will make it a felony to assault hospital and medical workers.
68% of nurses last year had some form of verbal abuse. Some even had physical abuse.
That, a national statistic from Dallas-Fort Worth Hospital Council President and CEO Stephen Love, who says many have left the profession in the last few years because of violence.
When we talk about workplace violence, we still want to recruit people into healthcare. So we have to explain to them that we're doing everything that we can to be safe.
All right, so let me share 3 things quickly. First of all, it's up to pardon and parole and probation to figure out who, how, and when they'll alert some facility that someone with an ankle monitor is coming to visit a loved one. You heard Rafael Anchia say regardless of which type of ankle monitor they may be wearing, some are equipped with GPS technology, some aren't. And lastly, the state representative says that lawmakers are really waiting on a big comprehensive report that will answer the question whether anyone, a violent offender, can ever successfully be on electronic ankle monitors.